Medical emergencies require prompt and effective care to save lives and minimize long-term damage. Healthcare professionals must have a deep understanding of the complexities involved in medical trauma. This slide sets the stage for the presentation, highlighting the critical importance of providing high-quality care for patients experiencing medical emergencies. The image depicts a busy emergency room scene, emphasizing the fast-paced and high-stakes nature of medical trauma situations. I will use this introduction to transition into the key topics we'll cover, such as the initial assessment, stabilization, and treatment of various medical traumas. Medical trauma refers to the emotional and psychological distress experienced due to a medical event or procedure, such as a serious illness, injury, or medical intervention. It can be acute, like from a sudden accident or emergency, or chronic, as in the case of long-term or life-threatening conditions. Medical trauma often occurs in healthcare settings where patients may feel vulnerable, powerless, or experience a loss of control over their own bodies and well-being. It's important to recognize and address medical trauma to support patients' emotional and psychological healing alongside their physical recovery. Acute trauma refers to sudden, unexpected medical events like accidents, injuries, or life-threatening illnesses that require immediate care. Chronic trauma involves ongoing medical conditions or procedures that cause physical and emotional distress over an extended period. Iatrogenic trauma is trauma caused by medical treatment or interventions, such as complications from surgery or medication side effects. Developmental trauma is trauma experienced during critical developmental stages, like childhood illness or disability, which can impact long-term health. These different types of medical trauma all require specialized care and support to help patients cope and recover. A serious illness, injury, or a life-threatening diagnosis can be deeply traumatic, leaving patients feeling vulnerable and afraid. Traumatic medical events like errors, misdiagnoses, or unexpected complications can lead to feelings of betrayal and loss of control. Prolonged hospitalization, away from normal routines and support systems, can be isolating and distressing, contributing to medical trauma. Traumatic medical experiences during childhood, such as painful procedures or frightening hospitalizations, can have lasting psychological impacts later in life. These various causes of medical trauma can have profound effects on a person's physical and mental well-being, and it's important to recognize and address these issues. Medical trauma is a serious public health issue, impacting a large percentage of patients. The pie chart shows the main types of medical trauma: adverse events, surgical complications, chronic illness diagnoses, and medical errors. Adverse medical events are the most common, affecting 40% of patients with medical trauma. Surgical complications account for 25% of medical trauma cases. 20% of medical trauma is caused by chronic illness diagnoses. Medical errors make up 15% of medical trauma experienced by patients. These statistics highlight the urgent need to improve patient safety and provide more trauma-informed care in the healthcare system. Medical trauma can lead to heightened anxiety, worry, and a constant state of hypervigilance as the individual struggles to cope with the emotional and physical aftermath. Depressive symptoms are common, including feelings of sadness, hopelessness, and a loss of motivation or interest in previously enjoyable activities. Individuals may suffer from post-traumatic stress, including intrusive thoughts, flashbacks, and nightmares related to their traumatic experiences. It's important to recognize the profound psychological impact that medical trauma can have on patients and to provide appropriate support and resources to help them cope and heal. Medical trauma can have immediate physical effects like increased heart rate, high blood pressure, and disrupted breathing over time. It may also lead to chronic conditions such as chronic pain, fatigue, and weakened immune function. Severe trauma can directly damage organs, tissues, or bodily systems, causing lasting impairment. Medical trauma can limit physical abilities, mobility, and independence, significantly impacting a person's quality of life. Medical trauma can lead to significant changes in brain activity and structure, which can have long-lasting effects on physical and mental health. The amygdala, which processes emotional responses, often shows increased activity, while the prefrontal cortex, which regulates emotions, exhibits decreased activity. Trauma can disrupt the body's stress response system, causing hormonal imbalances in cortisol and adrenaline that can have detrimental long-term impacts. Neuroinflammation is a common consequence of medical trauma, contributing to symptoms like cognitive impairment, fatigue, and pain sensitivity. Chronic stress from medical trauma can also lead to structural changes in the brain, such as decreased hippocampal volume, which is linked to memory and learning difficulties. Understanding these neurobiological changes is crucial for developing effective interventions and supporting individuals who have experienced medical trauma. Individuals with a history of trauma, such as childhood abuse or neglect, are more likely to develop medical trauma in response to healthcare experiences. Older adults may be more vulnerable to medical trauma due to factors like declining health, taking multiple medications, and a higher prevalence of chronic conditions. Patients from marginalized communities, such as racial/ethnic minorities or LGBTQ+ individuals, may face increased risk of medical trauma due to experiences of discrimination and systemic barriers to accessing quality healthcare. It's important to be aware of these risk factors when working with patients to help prevent and address medical trauma. Medical trauma can have a significant impact on individuals, but there are important protective factors that can help mitigate its effects. One key factor is social support. Having a strong network of family, friends, and healthcare providers who can offer emotional and practical assistance can be incredibly valuable. Resilience is also crucial. Developing effective coping strategies, maintaining a positive mindset, and cultivating a sense of purpose can all enhance resilience and help individuals better manage the challenges of medical trauma. Access to trauma-informed care is critical. Healthcare professionals who are trained to recognize and address the unique needs of medical trauma survivors can play a vital role in facilitating healing and recovery. Finally, engaging in self-care practices that promote physical, emotional, and mental well-being, such as exercise, relaxation techniques, and mindfulness, can also bolster resilience and support the healing process. Medical trauma can have significant psychological impacts, including intrusive thoughts, hyperarousal, avoidance, and emotional numbing. Intrusive thoughts are persistent, unwanted thoughts or images related to the traumatic medical event. This can make it difficult to move past the experience. Hyperarousal involves a heightened state of alertness, being easily startled, and having trouble sleeping. The body remains in a state of high stress and anxiety. Avoidance is a common coping mechanism where the person actively avoids reminders of the trauma, such as medical settings or certain procedures. This can interfere with necessary medical care. Emotional numbing is another way the mind tries to protect itself, by feeling detached or disconnected from emotions. This can leave the person feeling isolated. Understanding these common symptoms is the first step in addressing medical trauma and helping patients recover. The key focus of this slide is the diagnostic criteria for medical trauma, which is a critical step in accurately identifying and addressing this condition. A comprehensive assessment of the individual's medical history, symptoms, and functional impairment is essential for making an accurate diagnosis. Established diagnostic criteria, such as those outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, provide clear guidelines for diagnosing medical trauma-related disorders. Differentiating medical trauma from other medical or mental health conditions with similar symptoms is crucial to ensure the appropriate treatment is provided. The slide emphasizes the importance of a thorough, multifaceted approach to diagnosing medical trauma in order to ensure effective and tailored interventions. Medical trauma is a serious issue that can have significant impacts on individuals' mental health and well-being. The screening process involves several key steps: identification, assessment, diagnosis, and referral to appropriate treatment. Identifying those who may have experienced traumatic medical events is the crucial first step. This helps ensure they receive the support and care they need. Comprehensive assessment tools are then used to evaluate the individual's symptoms, the impact of the trauma, and their response to it. Based on the assessment, a professional can provide a diagnosis of medical trauma or related mental health conditions. Finally, individuals identified with medical trauma are referred to evidence-based interventions and treatment providers who can address their specific needs. This systematic approach is crucial for ensuring those affected by medical trauma get the help they require. A thorough assessment of medical trauma examines the physical, emotional, and cognitive impact on the individual. We'll conduct a clinical interview to gather details about the trauma, the person's symptoms, and their coping mechanisms. We'll also use standardized psychological assessments to quantify the severity of PTSD, anxiety, depression, and other mental health concerns. Reviewing the person's medical history helps identify any physical injuries or complications related to the trauma. This comprehensive evaluation gives us a clear picture of how the trauma has affected the individual, so we can develop an effective treatment plan. Medical trauma can have a significant impact on patients, leading to PTSD and other mental health issues. Fortunately, there are several evidence-based treatments that can help patients process and overcome their traumatic experiences. Cognitive processing therapy, CPT, helps patients challenge and modify unhelpful thoughts related to their trauma, leading to a reduction in PTSD symptoms. Prolonged exposure therapy, PE, gradually exposes patients to trauma memories and reminders in a safe environment, allowing them to process and desensitize to the trauma. EMDR, eye movement desensitization and reprocessing, uses rapid eye movements to help patients reprocess and integrate traumatic memories, reducing their emotional and physiological impact. These treatments have been shown to be highly effective in helping patients with medical trauma, and we'll discuss each of them in more detail in the following slides. CBT is a well-established, evidence-based approach for addressing the cognitive and behavioral aspects of medical trauma. It helps patients identify and challenge negative thought patterns that contribute to trauma-related distress and maladaptive behaviors. Patients learn practical coping skills and relaxation techniques to manage anxiety, panic, and other trauma-related symptoms. Gradual, controlled exposure to trauma-related stimuli can help desensitize patients and reduce the intensity of their fear and anxiety. The calm, supportive atmosphere and collaborative nature of CBT sessions help build trust and facilitate the healing process. EMDR is a powerful therapy that uses rapid eye movements to help the brain reprocess traumatic memories, reducing their emotional impact. Research has shown EMDR to be highly effective in treating post-traumatic stress related to medical events and procedures. EMDR can be tailored to address a wide range of medical traumas, from sudden injuries to chronic illness experiences. Many clients report reduced trauma symptoms in as little as 3 to 5 EMDR sessions, making it an efficient intervention. EMDR is a transformative therapy that can help individuals heal from the emotional wounds of medical trauma. Medical trauma can have a significant impact on an individual's mental and physical health. Pharmacological interventions can play a crucial role in managing the symptoms of medical trauma. Medications may be used to address issues like anxiety, depression, and insomnia that often arise following a traumatic medical event. These pharmacological treatments are typically used in coordination with other evidence-based therapies like psychotherapy to provide a comprehensive approach to recovery. Specific medications may be tailored to the unique needs and symptoms of each individual who has experienced medical trauma. It's important to work closely with healthcare providers to determine the most appropriate pharmacological interventions for managing medical trauma. Medical trauma can have significant physical and emotional impacts on patients. Complementary and alternative therapies can be powerful tools to support recovery. Mindfulness and meditation help manage stress, improve emotional regulation, and promote self-awareness. Gentle yoga and controlled breathing exercises can alleviate physical tension, calm the nervous system, and facilitate deep relaxation. Creative therapies like art and music allow survivors to express emotions, process experiences, and cultivate a sense of control. Acupuncture and massage can relieve physical symptoms like pain and muscle tension while promoting overall well-being. Medical trauma can be an incredibly isolating experience, but social support can make a big difference in the recovery process. Family, friends, and support groups provide an important emotional outlet, allowing survivors to process their experiences and emotions. Practical assistance from one's social network, like help with transportation, childcare, or household tasks, can be invaluable, letting survivors focus on their healing. Research shows that strong social support is linked to better mental health outcomes and can accelerate the healing process for medical trauma survivors. Positive relationships instill a sense of belonging and purpose, which enhances a survivor's ability to cope and build resilience. Medical trauma can be incredibly challenging, but many survivors exhibit remarkable resilience. They are able to bounce back and find ways to adapt and thrive, despite their difficult experiences. In some cases, individuals may even experience post-traumatic growth. This means they emerge from the trauma with a deeper appreciation for life, stronger relationships, and a greater sense of personal strength. By finding meaning and purpose in their experiences, medical trauma survivors can build a sense of hope and optimism that fuels their recovery and personal growth. Their stories of resilience and post-traumatic growth can be incredibly inspiring. Treating medical trauma requires careful consideration of ethical principles. Informed consent is critical. Patients must fully understand the risks and benefits of trauma-focused treatments and provide voluntary consent. Protecting confidentiality and privacy of trauma survivors is essential to building trust and safety in treatment. Institutional oversight through review boards and ethics committees is important for approving trauma-focused research and clinical practices. Caring for patients who have experienced medical trauma can take an emotional toll on healthcare providers. It's important to develop strategies to manage stress, anxiety, and secondary trauma reactions that can arise from this work. Engaging in regular mindfulness practices like meditation or deep breathing can promote emotional well-being and resilience. Collaborating with colleagues to create a supportive network and share experiences, challenges, and coping mechanisms can be invaluable. Advocating for trauma-informed policies and resources within your healthcare setting can help prioritize provider self-care. Healthcare providers often experience secondary traumatic stress from witnessing the suffering of patients and dealing with the emotional demands of the job. It's crucial that we address this issue to support the well-being of our healthcare workforce and prevent burnout. This slide outlines 3 key strategies we can implement to help healthcare providers manage secondary traumatic stress. Self-care practices like mindfulness, exercise, and counseling can help providers manage their own stress and prevent burnout. Peer support groups provide a space for providers to share experiences, find mutual understanding, and develop coping strategies together. Ensuring easy access to mental health resources, including counseling services, within the healthcare organization demonstrates our commitment to supporting provider well-being. Implementing these strategies can create a more resilient and supported healthcare workforce, which ultimately benefits both providers and patients. Medical trauma requires a collaborative, interdisciplinary approach involving healthcare professionals from various disciplines: physicians, nurses, psychologists, social workers, and others. Integrating physical, psychological, and social interventions is crucial for comprehensive treatment and recovery from medical trauma. This holistic, integrated care is key. Addressing the complex and multifaceted needs of medical trauma survivors requires evidence-based treatments, support services, and rehabilitation programs tailored to their unique circumstances and challenges. Trauma-informed care is a patient-centered approach that prioritizes the safety, choice, and empowerment of patients who have experienced trauma. It's important to create a calming, welcoming environment in medical settings to help put patients at ease and make them feel safe. Healthcare providers need training on the impacts of trauma and how to respond sensitively to patients who may be triggered or distressed. Interdisciplinary collaboration between medical, mental health, and social service providers is key to coordinating comprehensive, trauma-informed care. By adopting these trauma-informed principles, we can improve patient outcomes and experiences in the healthcare system. Medical trauma is a serious issue that affects many people, often with long-lasting impacts. Advocacy groups play a crucial role in raising awareness about the prevalence and challenges of medical trauma. These groups work to enact legislative changes that protect the rights of survivors and ensure access to appropriate care. They also push for trauma-informed practices in healthcare settings to create a safe, supportive environment for survivors seeking treatment. Advocacy efforts also focus on facilitating peer-to-peer support networks and connecting survivors with valuable resources to aid in their recovery process. By addressing these key areas, advocacy groups are making important strides in supporting medical trauma survivors and improving their overall well-being. Novel research approaches like longitudinal studies and multi-site collaborations will deepen our understanding of medical trauma and guide more effective interventions. Stronger partnerships between researchers and clinicians will translate research findings into trauma-informed care and evidence-based practices in medical settings. Centering the lived experiences of medical trauma survivors will shape research priorities and drive more patient-centered, empowering approaches to treatment and recovery. Medical trauma can have a profound and lasting impact on individuals, affecting their physical, emotional, and psychological well-being. However, by fostering resilience, providing comprehensive support, and advocating for systemic change, we can empower those impacted by medical trauma to heal, reclaim their lives, and thrive despite the challenges they have faced. This presentation will explore strategies and initiatives that can help medical trauma survivors overcome the obstacles they face and regain a sense of control and empowerment in their lives. Through a holistic approach focused on resilience, support, and advocacy, we aim to create a more compassionate and responsive healthcare system that better serves the needs of those who have experienced medical trauma.